There are 14 facial bones. So where the cranial bones form the cranial cavity, the facial bones form what we would call the framework of your face. And of these 14, all but 2 come in pairs. So there are 6 pairs of facial bones and then 2 that do not come in pairs. So let's start with the maxillae. The maxillae are a pair of bones that form your upper jaw. So notice that they will fuse together right here at the midline, and they form your upper jaw. They form a portion of what we call your hard palate. So the hard palate is the roof of your mouth. And we call it hard palate when it's formed by bone, but behind the hard palate there's what's called the soft palate, which is made up of soft tissue. So you'll notice your hard palate is actually formed by the maxillae, but also bones known as the palatine bones. All right, so those are the maxillae. As far as structures to know, they have holes known as infraorbital foramen. So remember, we had supraorbital above the orbits. We have infraorbital foramen below the orbits. And those serve a similar function in that they allow nerves to pass through the bone. And then this portion of the maxillae that form this anterior hard palate, that's known as the palatine process. So these are the palatine processes of the maxillae. The palatine bones form more of the posterior hard palate. And where they form this hard palate, that portion's known as the horizontal plates. So the horizontal plates of the palatine bones and the palatine process of the maxillae form your hard palate. Next 2 bones are the zygomatic bones. So the zygomatic bones form what we would typically refer to as our cheeks. So they're often called cheekbones. So there's one here and then one here shown in green. The nasal bones are a pair of bones that form this, what we would call the bridge of your nose. The bridge of your nose is basically where your glasses or sunglasses would rest. So those are known as nasal bones. The inferior nasal concha, if you remember, are in the nasal cavity. All right, so these, again, they're separate bones known as inferior nasal concha, where the middle and superior, which you don't see, are part of the ethmoid bone. But those, let me remind you what the nasal concha do. They increase the surface area of your nasal cavity. So this way that when the air enters through that nasal cavity, it gets filtered really well because things are going to stick to the mucous membranes. The air gets warmed up because there's a lot of blood flow in your nasal cavity, and that's why a lot of people have nosebleeds, is there's just a lot of blood vessels. But that blood is in there to help warm up the air because blood's warm. And then it also helps to humidify. So the mucus helps to humidify the air. So your nasal cavity acts like a big filter for the air entering your respiratory tract. The next bone is known as the vomer. So the vomer, so that's one of the 2 that just comes in a single bone. It's not a right and left, it's just one. That helps form that nasal septum. So remember, the perpendicular plate comes down from the ethmoid bone, joins the vomer, which is down here, to form your entire, what we call the bony nasal septum. Because you also have cartilage that's part of that nasal septum. All right, lateral view, we see the zygomatic bone here clearly, right? We still see these cranial bones here. We see in here, this area is a small bone called the lacrimal bone. So lacrimal is in reference to the lacrimal glands that produce tears. So these lacrimal bones actually form a small little opening here called the nasolacrimal canal. And the tears that drain off your eye collect in this little nasal lacrimal canal and drain into your nasal cavity. All right, so these are just two little bones that help form that little drainage canal for tears. Okay, now we're on to the mandible. So a couple things to remember from the mandible. One, it's the only movable bone in the skull. All right, all the other bones are fused together with each other using joints we call sutures. And we'll talk about some of the major sutures as we go. But this joint here, called the temporal mandibular joint, or TMJ, is a synovial joint. And synovial joints are movable joints. So now you can elevate, depress, protract, retract. You can move your mandible side to side, all because of that movable joint. So mandible forms your lower jaw. It has three structures we're going to identify. The first one is known as the mandibular condyle. I'll remind you, a condyle is a fairly large rounded surface that forms a joint. So that mandibular condyle forms a joint with the mandibular fossa of the temporal bone to form that TMJ, temporal mandibular joint. There's also a process that kind of sticks up like a crown. It's known as the coronoid process. The word coronoid means crown. So it kind of, and you can't see it all because it kind of ducks behind the zygomatic bone there. But that's known as the coronoid process. There's a number of muscles of mastication that attach to it. Muscles of mastication are muscles that you use to chew. And then the last one is, oops, let me go back. That's not labeled here. That little hole there is called the mental foramen. If you recall, the chin region has a name. It's the mental region. So this little hole there is called the mental foramen. All right, a few little extra things that we typically cover when we study the skull. The soft spots. So you'll remember from the previous chapter, we learn about intramembranous ossification, where you have membranes that form the flat bones. Well, and this is a fetal skull here, so this is a baby skull. And these are these soft spots called fontanelles. But that's area of unossified connective tissue membranes. So this skull is going to be very flexible, and that allows it to fit down the birth canal. When this ossification finishes, in between these flat bones, we have what's known as sutures. And we're going to learn the four major sutures. And what you can really do when you're learning sutures is just think of the parietal bone as kind of a square bone. And each of the four sides of the parietal bone forms a suture. So you have what's called the coronal suture here. All right. Now remember, if you were to cut through that coronal suture, you'd do a coronal plane. So if you remember your planes. So that's called the coronal suture. It holds the parietal bone and attaches it to the frontal bone and attaches it to the two parietal bones. What holds the two parietal bones is the sagittal suture, and we should remember that word. That's another plane. And then back here you see another suture called the lambdoid suture. So that's the suture that forms in between the occipital bone and the parietal bone. And then the fourth suture forms between the temporal bone and the parietal bone, and that's known as the squamous or squamous suture. So we've heard of coronal and sagittal. Lambdoid comes from the Greek letter lambda. Greek letter lambda kind of goes up and then down. Well, that suture kind of goes up on one side and then goes down on the other side. And then squamous, we've heard that word before. Squamous means flat. So they called that suture the squamous suture, because the two bones are kind of overlap one another. So they're both flat, and that helps form that suture. So those are the four sutures that are usually the four that you learn. This is just another picture of the nasal septum. And then if this nasal septum is removed, you can see the nasal concha. Notice that this is the ethmoid bone and the perpendicular plate. Here's the vomer, shown kind of in a light blue. And then there's cartilage that kind of forms the tip of your nose. All right, so those three structures all form the nasal septum. And then you can still see the frontal bone here and the frontal sinus. There's a nasal bone there. There's the sphenoid bone and its sphenoidal sinus. You can even see the hard palate here. So remember, the hard palate is formed by the maxillae and the palatine bone back here. So every picture you look at, you can kind of see those same bones, but maybe see them at a different angle. And then again, if you were to remove that septum, you can see the nasal concha. So there's the inferior, there's the middle, and there's the superior, and they're of the ethmoid bone. This is another picture I kind of stole from another book. I just happen to like it. It just gives you yet one more view of some of these bones that are forming, the nasal cavity or these nasal concha. So you can also see the septum here. So there's the nasal septum. We see vomer down here. There's the perpendicular plate coming down from the ethmoid bone. We see the crista galli sticking up from the ethmoid bone, attaching those meninges. We see the nasal concha, and you can kind of see how they got the name concha. Concha comes from the word conch, like a conch shell. Those are those seashells that kind of have a spiral pattern to them. So these kind of spiral into the nasal cavity. So there's the superior, middle, which is part of the ethmoid bone, and there's the inferior nasal concha. Then you can see the maxillary sinus. So that's the fourth bone that has paranasal sinuses. We had the frontal sinus, the ethmoidal sinuses in here. You don't see the sphenoidal sinus in this picture, but then you also see the maxillary sinus. So kind of an interesting picture. And then this is our paranasal sinus slide. So paranasal sinuses, paranasal means they surround the nasal cavity, right? So if this is your nasal cavity, these sinuses surround it. They're kind of air-filled. They have mucous membranes, so they could produce mucus. Sometimes if you get an illness, you'll produce more mucus in these sinuses. They serve as resonating chambers, so they can kind of modify the sound coming from your vocal cords. And then these are the four bones that have paranasal sinuses: frontal, maxillary, sphenoidal, and ethmoidal sinuses, all surrounding that nasal cavity. Okay, last bone for this video. It's not considered part of your skull, but it's also not considered part of your vertebral column. So we'll just kind of stick it in at the end of this video. It's known as the hyoid bone. The word hyoid actually means U-shaped. So the bone kind of has a U shape to it. It lies just beneath your tongue. It kind of supports your tongue underneath the mandible. And it's best known for being the only bone in the human skeleton that does not articulate with any other bone. So articulate means you form a joint, all right? You attach to another bone. This bone doesn't attach to any other bone. Notice on this drawing, it kind of looks like it's just floating there. Now it's held in place with soft tissue, all right, but it doesn't physically attach to any other bone in the body. So that's kind of what it's famous for, if you will. Its job is to support the tongue. There's some muscles that come off of it and kind of go into your tongue to help you move your tongue. It also kind of keeps your respiratory tract open, so your respiratory tract goes right through that hyoid bone. So it helps keep that respiratory tract from kind of collapsing. So it keeps it open. When someone gets strangled, they often look at that hyoid bone because in extreme strangulations, quite often that hyoid bone fractures or breaks. Okay, next video we're going to move down the vertebral column.